Hello, everyone, and welcome to our monthly community outreach podcast. My name is Ana Isidame, Health Promotion Specialist, and joining us today is Ana Lopez and Elizabeth Hanson. Can you both tell us a little bit more about yourselves, what you do, and how long you've been with the health department?
Sure. Like you mentioned, my name is Ana Lopez, and I've been with the department. It will be 11 years in March, and I mostly worked with breast and cervical cancer and heart health programs.
Okay, thank you, Ana.
Hi, I'm Elizabeth Hanson. I've been with the health department for 4 years, and I just recently moved to the program Care for Yourself, WISEWOMAN.
Awesome. So February is American Heart Health Month. Can you tell us a little bit more about the WISEWOMAN program, how it relates to Heart Health Month, and the services it provides, and who it qualifies?
The WISEWOMAN program is a program that's funded through the CDC. It's not a nationwide program. Only 21 states participate in it. Iowa is very fortunate to have it. It has been providing these type of services to Iowa women since the year 2000, and it provides heart disease and stroke risk factor screenings and promotes healthy behaviors to low-income, uninsured, or underinsured women that reside within the state between the ages of 40 to 64.
So you mentioned that here at Siouxland District Health Department, we serve 7 counties. What are those counties that we cover?
The counties we serve are Cherokee, Ida, Lyon, O'Brien, Plymouth, Sioux, and Woodbury County. However, only 3 community health centers are WISEWOMAN providers. And they are Siouxland Community Health Center here in Sioux City, Siouxland Community Health Center in South Sioux, and Promise Community Health Center in Sioux Center. So if a woman wants to participate in the WISEWOMAN program, they would need to see a provider in one of those health centers.
Okay, so just one of those health centers that participate in the program?
Yes.
Okay. So you mentioned that basically you promote healthy behaviors to low-income, uninsured, and underinsured women. Can you talk a little bit more about the insurance aspect of it?
Sure. They can have insurance. For some women, their copay is too high, and that prevents them from getting their screening. So if that is the motive, they can enroll as long as they're within the income guidelines that our program offer.
Where can someone find those income guidelines?
Sure. These can be found in the Iowa Department of Health and Human Services webpage.
They just go onto the webpage and search for it?
Yes.
And it should be fairly accessible to them?
Yes, it
okay.
should be. Mm-hmm.
So why is learning about heart disease and reducing one's risk important?
Sure. Heart disease is the leading cause of death for men and women. It's preventable by making behavior or lifestyle changes that can reduce your risk.
How would someone know if they are at risk for heart disease?
Having high blood pressure, high cholesterol, or high blood glucose, obesity, excessive alcohol consumption, and smoking are all risk factors. 3 of those risk factors you will only know if you visit your doctor. So that's why it's very important to at least visit your doctor for an annual physical.
So physicals are important in order to identify those risk factors. At what age should a person start getting those health screenings?
They should maybe start at late 20s, mid 30s for cholesterol and blood pressure screenings, maybe in their 40s for high glucose levels. But it varies. It all depends on personal risk and family history. Like if you have a concern or are worried that you might be at risk, talk to your provider.
Are there any tips that you can give us today that might lower one's risk?
Sure, by making healthy food changes like more vegetables, fruits, whole grains, lean meat, eating less salt, saturated fat, low-fat dairy products. Also adding at least 150 minutes of exercise and moderated exercises. Also, they can also add 2 days a week with muscle strength activities. This can limited alcohol consumption.
Mm-hmm.
If you're a smoker, let's quit smoking.
What if someone's on medications?
They should follow the medications as the guideline the provider give you, and monitoring your blood pressure is also very important.
Right, monitoring it,
Mm-hmm.
checking up on it, and
Yes.
all of that, making sure that it is where it's supposed to be.
Yes.
Mm-hmm.
Mm-hmm.
So who should the public contact if they have any additional questions or concerns?
They can call us here at Siouxland District Health
Mhm.
at 712-279-6119 and ask for Elizabeth or Ana, and we both speak Spanish in case we have a Spanish speaker out there.
Right. Is there anything else that you would like to add or think is important the public should know?
I just want to reiterate that living a healthy lifestyle is very important to reduce the risk for heart disease. You don't need to make all the changes at once because it's usually very overwhelming for
Mm-hmm.
most people. So you can start small, start with one. Once you feel comfortable with that one, just add another and continue improving, and you will see a change.
Yeah, well, those are great tips. Thank you, Ana. Thank you, Elizabeth, for joining today. And thank you for tuning in to our podcast this month. Definitely join us next month at noon, where we will be discussing a different topic. Thank you.
Thank you.
Thank you.